Thanks, Joy. Okay, I had to get my handheld mic because I am so bad at standing still that if I had to stand still here, you'd never hear me because I'd keep walking away from the microphone. So the most important thing is that everybody should have wiki sticks on your table. If you don't know what they are, don't worry, we'll play with them a little later. You can play with them now if you want. But if you don't have wiki sticks, if you raise your hand, my lovely husband and assistant Vanna White today will be walking around with them for you as well. All right, so as Joy said, I am the person who talks about change a lot. And this morning, or actually yesterday, as I drove here, I'm from Massachusetts. We got about 3 hours into our trip, and I looked at my husband and I went, oh shit, I forgot my dress. It's hanging in the laundry room because I came back from a conference in Kansas City, Missouri, and bought a fabulous dress. There was a woman there who, at our conference, it was Women Leaders in Sports, and she was one of the people who had won Project Runway back in the day, and she had all these handmade, gorgeous dresses, and I was like, I am buying one to bring to Maine with me. And then we are an hour away from Maine, and I realized it is lovely hanging in the laundry room. So Joy, I'm very excited that I actually had a pair of pants with me because the rest of my suitcase are all leggings. So you might have been seeing me today wearing leggings and old sweatshirts because those are my comfort driving clothes. So that was my squiggle point today. So boy, right? Bold moves, uncertain times. It's like there's the big things and there's the little things, right? Now, nothing terrible would have happened if I was on stage in my old sweats, but I feel like people aren't going to take me quite as seriously, nor do I want photos taken of me that go out in the world of me wearing old sweats on stage. Okay. I want everybody to cross your arms like the most angsty teenager that you've met. I have two 21-year-olds, so we're a little bit past this, but I feel like we can get some good attitude, right? You got your attitude going. This is I'm annoyed with all of you. Now I want you to switch your arms. Whatever arm was on top, put on the bottom. Whatever's on bottom, put on top. How many love that? How many can sit like that for the rest of the keynote, right? The wrong way. What's your name, sir? Andy. Andy's good with change. We'll give Andy the gold star for change, right? Because I always think, people think change is like, why is it so hard? I'm like, I just asked you to cross your arms differently than you do. And the looks on your faces, like, I wish I would just snap a picture and could project it instantly, because half of you had this face of disgust, right? Of like so annoyed, like, I can't believe, what do you mean? And then some of you had that look of complete confusion. You're sitting there going, wait, which arm goes up, which arm goes down? You can't even figure out how to do it. So that's where we start with a little bit of change. And the question that comes up all the time, well, not the question, but really the point of this is it's not if things are going to change, because it's going to change. Things change all of the time. Things change every day. And, right, it's about how we respond to change. It's not about the change itself. It's the change that's not the hard thing. It's how we respond to it. And sometimes we decide to respond to it one way, and sometimes we have no choice but to respond really quickly. And, this last, I don't know, what month are we into since January? Too many, right? But it's been rapid whiplash change, right? I think of the race car drivers who have to make those last minute decisions. And I feel like we are all in this moment of you think you're going one way and then the next day you're going a completely different way, right? I had a friend who works for the CDC who emailed me on Friday saying, that's it, I've lost my job, it's done, I'm over. And then on Monday she wrote back and she said, haha, just kidding. Actually still have a job, but probably should get my resume ready anyway, just in case, right? But it's the whiplash of this is huge right now. So a lot of people are living through this. So you have your wiki sticks on your table. Open them up, play with them. If you have not had a child in the last, I don't know if they still hand these out at restaurants, but when my kids were little, these were the thing, right? And so I want you to just think about, if you're one of those people who likes making symbols of things, like put together what's your role in this whole thing? Like what's your role in work these days? What's your role? When I did this last week, I had somebody who made a spiral, right? I had someone who made a braid. I had someone who just dropped them all on the table, someone who made chaos with it. But just play with them. And if you don't want to build your role, that's fine. Just kind of play with them and build with them, because neuroscience tells us that when our hands are busy, we actually learn better. So feel free to play, and you'll remember this a lot more. And you'll talk about the lady who gave you wiki sticks after. So we will come back to them at the end of the talk, though. So I'm going to make sure everyone has them open, and you can start playing with them. All right. So all of the changes that are happening rapidly for all of you, right? It is everything. It is coming at you quickly. This is a picture of me back in 1995, a much younger, a much darker haired version of myself. And this is 24 hours before my appendix came out. This is my last day in New Orleans. I flew home, and then the next day, I ended up going to the emergency room to have my appendix out. And so when I think of things that we're coming up against now, on this day in 1995, I get in the hospital. I meet with the surgeon who is going to take my appendix out. And he says, we're going to try really hard to get you in before midnight. And I was like, oh, thanks. I'm in a lot of pain. And he's like, nope, the nurses are going on strike at midnight. I was like, oh, this is going to make for a fun day, right? And long time ago, so they were still dealing with staffing shortages happened all the time. The nurses all walked out at midnight. I got rolled in for my surgery at 11:45 p.m. The nurses stayed in for the room. I assume they did because I made it out of surgery. And that night, right before I go into surgery, I leave a voicemail for my boss because this is pre-cell phone, right? So I leave a message on her voicemail box. Fast forward, it's now Friday, and I call Barry, our HR person, and I say, hey, Barry, how do I get my paycheck? Because it's 1995, and you had to actually get your physical paycheck back then. And he said, what do you mean, how do you get your paycheck? You pick it up in my office like you do every week. And I said, no, I'm not there. He said, what do you mean you're not there? I'm like, I've been out all week. I had my appendix out. Like, I've been literally sitting on my bed, like in my bed for a week. Like, I haven't been there. He goes, you haven't been here? Gets better, right? Goes down the hallway to my boss, who then says to him, oh, I get so many messages these days, right? We are so short on staff. I am so burnt out. I am so stressed that I put a Post-it note over the light on my phone so I wouldn't see that I had messages because it stressed me out too much. It's my boss, right? So she didn't even know I wasn't there. I was not at work for 5 days and nobody noticed. Fast forward when I finally get back and I'm like, okay, this is I can't believe I work at a place that wouldn't notice this. I ended up being out for 3 more weeks because I'm one of those lucky people who has an appendix that's not where your appendix is supposed to be. And because this was 400 years ago, 1995, they didn't do things like CAT scans before you went in for surgery. They just cut open and dig around until they find it, right? So I'm out for a month. I come back and I say to my boss, gosh, I can't believe nobody noticed I wasn't there. And her answer was, oh, you're so responsible. We assumed you were doing something. And the voice I heard in my head is the voice that I would say now, because now I'm old, is I heard my mother saying, I could have been dead on the side of a road in a ditch. Right? That was my mom. Every time I drove somewhere, I had to call her as soon as I got there, but not actually call for her to answer the phone because every phone call cost money. So you called, you let it ring twice, you hung up, then you called back and let it ring twice and hang up. So she knew you weren't dead in a ditch on the side of the road. Right? So that was my first adult healthcare experience, right? Was me getting my appendix out and having nobody notice it. But the other part of this that I go back to, right, the rising costs of healthcare. As a very, very intelligent 25-year-old, when I called Harvard Pilgrim Health at 9 o'clock at night and said, I think this is what's going on, and they said, hang up, call 911, have an ambulance come get you, to which I hung up with them and I called the Boston taxi to come get me. because my roommate and I sat there and said, oh God, what if our health insurance doesn't cover the ambulance? It's probably like $500, and we are young people working in Boston at small nonprofits. And I'm like, I can't afford a $500 ambulance ride. So I took a taxi to Brigham and Women's Hospital. That's not the most comfortable taxi ride, let me just tell you, when your appendix is coming out. And then managed to call my parents and tell them I was at Beth Israel Hospital, because they were both B hospitals that were in Boston that were a block apart. So my poor parents drive from New York and go to the wrong hospital and can't find me. Until some nice nurse says to them, I bet your daughter didn't know which hospital she's at. Let's go check the other ones. But right, so even then, right, the rising cost of healthcare was terrifying, right? And so these things keep coming, right? They're straining on the educators for all of you. They're straining on the providers. Everybody is stressed out about this. So I don't have all the answers today. Like, I'm sorry that by the end of this, you're all not going to feel hunky-dory about everything, but I hope I give you some tips, some little pieces that are going to get you to think better and kind of have some ideas. So here's the thing, right? Part of it is our own mindset. We think everything, our careers, our lives, right? We start at point A, and it's this beautiful straight line to the end, right? Ask any college student. I said I have two girls who are seniors in college. All of their friends think, if you ask them, they're going to get a job doing X, and they are going to do X from now until they die. Right? How many of you are doing a job that you thought you were going to do when you graduated high school, when you were 18? Anyone? I think we have one. I think you're my one person. Right? What do? You tell people what to do. That is awesome. I feel like there's a lot of people in this world who would love that job title. What is your job title? I tell people what to do, right? But I think aside from an occasional, I feel like you see some nurses, some doctors, some teachers, but the majority of us, we're not doing what we thought we were gonna do, right? We had no idea, most of us, that our job even existed, right? If you had asked 18-year-old you about the job that you have now, would they even believe that you're doing it, right? Would they even know what it was? Probably not. Right? And then this is what it actually looks like, right? It looks like some little kid has drawn some kind of crazy line. Or your wiki sticks. I see someone pointing at it, right? And pointing at their table, right? This is what your wiki sticks start to look like, right? It becomes a squiggle. It is never a straight line. And we all think it's going to be. And so step one, I think, in learning to kind of be okay with change and kind of uncertainty and all that is just acknowledging the fact that it is just never a straight line. It's never, right? All right, so the next thing is that the rapid change in the workplace is getting faster and faster, right? Anyone recognize something that looks like this? Is anyone, somebody said they still have them, right? Fast forward that same job where my boss didn't see me, didn't notice I was gone for a week. At that same job, we had one computer for the four of us who were in charge of job coaching and job development for all the people who came through our programs. And so we had a sign-out pad next to it, and we would sign out for the time slots so we could use the computer to write resumes. And then we would print out a resume and go make 100 copies of it for someone, right? So it was the same thing that when someone was like, hey, we're gonna have a holiday party this year, somebody went and either drew a picture on a piece of paper, right? Or if you had someone who was wild and crazy and knew how to use that new fandangled PowerPoint where you could make one slide per file, right? With the balloons on it. If you had someone who did that, they would create it, then they would print it out. Then they would go make 200 copies. They would put one in everybody's mailbox. Then you had the two people who worked offsite at a different office, and you would fax it to them, right? One of my first jobs out of college, I worked at VinFen, and I was helping people with disabilities get jobs. And I placed probably 7 or 8 people in roles where their entire job was to sit near the fax machine and deliver faxes within the company. It's their whole job, 40 hours a week, delivering faxes. Right? It's like, no one does that anymore, right? And so you think of how drastically different it is now, right? How much time we save on those things, but now we've added 950 other tasks, right? So What's the thing that you used in your first job that doesn't exist anymore? A mimeograph machine. I remember passing along my Rolodex to the next person when I left. Like I had 3 Rolodexes and I remember like gifting them to the next person. Pencil sharpener on the wall. A pager. Rotary dial. Yep, dialing the phone right. Yep. What else? What were you using early, right, that you don't use now? Typewriter. Joy and I were talking earlier about remembering when we got our Palm Pilots and how amazing it was. Like when one of our friends got it, when Jeff got it, and he came up and like dinged our Palm Pilot. We're like, oh, we can share contact information like that. Like we don't have to actually send it to each other. But it was a wild and crazy thing. Right? Things are changing so rapidly, and they change all the time. And we all respond to it different. Right? People are going to respond to things very differently and how they kind of respond to change. And there's all these different change models out there, but I really found it came down to these 3 things, right? The first is the seriously moment, right? We're doing this again. Next is the pit of despair. And then finally you get to let's go. So let's talk about these and see how we can make this happen, right? First is what I always refer to as the seriously phase. You can tell I have 2 21-year-olds, and I kind of came up with this phase when they were in high school, right? You can hear it in your head. Teenage girls saying, seriously? That's this, right? This is because as soon as somebody mentions change, half the people in the room are like, oh my God, again? Didn't we just do that? Because didn't we just do that? It might have been 10 years ago, but it feels like it was yesterday, right? I remember getting a job in higher ed. I was working at Smith College, and I came home the first day, and I said to my lovely husband in the back, and I said, oh, we use this email system called GroupWise. I was like, is that some new email system? Because I had never heard of it. And he was like, yeah, no, that had like end of life like 5 years ago, right? Like it was so old that it wasn't even supported. And so when the college made the change to Gmail, you would have thought they killed all the babies and dogs of the world or something when we made the switch to Gmail. The amount of angst and anger and, oh my God, I can't believe we're doing this again, when again was over 20 years, right? And the email system didn't even work, right? We were moving to something that worked, and people still stress over this. So when you get to that first stage, you want to be able to shift your mindset, right? If you can get people thinking from the beginning that this is okay. The next is communicating the change. Often when people are saying something's going to change, they don't actually communicate it well. I was working with a nonprofit on Cape Cod last year, and they were talking about changing their payroll system. And they were changing their payroll system because the system they had was no longer secure. They found like there was data leaks, it had happened more than once, and decided this is not where we want our people's banking information, right? So we're switching the payroll system. That was great. The leadership knew that, right? Director level kind of knew that. Some managers knew it. Frontline staff, did any frontline staff know why they were changing it? Nope, not a clue. All they knew was now they have to go through training again on how to use a new payroll system and figure out a new payroll system. And if you've ever changed payroll systems, it's very painful. And there's a really good chance that first week that not everybody's going to get paid how they should, right? It is not a happy moment for folks, right? But they didn't communicate the change. They didn't communicate any of the whys behind it. Nobody understood why. They just knew we were doing this, and it was just some leadership person who made some decision, right? That's how everyone on the front line saw it. And then it's acknowledging where people are, right? Thinking about these uncertain times, right? To be able to come out and say, like, we have to make this change again. I get it, it sucks. Like, this is not what we planned, right? We had no idea this was going to happen. This is not what we wanted to do. I know that you're really comfortable where you are, but we have to make a move, right? We have to make this change. The next is the pit of despair, right? This is okay, everyone's all right, we understand we're making the change, and everyone kind of, jumps to that bottom moment of like, this is the worst thing that has ever happened in our lives. The problem here is you get the people like Susie here, right, who gets super comfortable in the pit of despair, right? She is like kicking back, looking at the stars. She's like, this is the greatest thing ever. She is that person who is the biggest negative Nelly that you've ever had in your department. And she's like, this is great. I am going to stay in the pit of despair. And for the rest of my time working here, I am going to talk about how things used to be. Right? I worked at Smith for 10 years, and the person who was most devastated about us switching from GroupWise just retired. And I swear you could hear her voice on her way out the door going, it was after we switched to Gmail that everything went downhill, right? Like it was the worst thing we ever did. So if you have those people in the pit of despair, you have to think about how you're going to move them forward, because change is happening and it's going to happen quickly and people have to adapt. So first is what is the smallest possible thing you can get them to do towards it? If you're changing payroll systems, let's let them at least understand how to open it, right? Let's get them learning to change, to use it, to make that change. But think about what is the tiniest step, because what happens with most people, so think about your New Year's resolutions that you've had through the years. And if you've given up on them, good for you, because most times they don't ever come to fruition. But if you are the New Year's resolution kind of person, and your New Year's resolution this year was to run a marathon. Any runners here? Excellent, okay. If your New Year's resolution was to run a marathon, what is the first thing you probably did on not January 1st, because you might have had too much fun on New Year's Eve. So January 1st, you wake up and you're like, tomorrow I start marathon training. And what do you do on day one? Go out really hard. You're like, I have not run more than 4 steps to the microwave when the popcorn is burning, right, for the last 7 years. But today, I'm a marathoner, so I'm going to go run 5 miles, right? And what happens the next day when you wake? Well, one, if you make it the 5 miles, good for you. But then what happens the next day? You wake up. You can't walk. And so you're like, screw this, I'm not doing this anymore, right? Marathoning, terrible. Right, but what if on day 1, you were like, I'm going to go do some research on where to go buy sneakers, right? Step 2, you go buy the sneakers. Right? You start thinking about, like, can you take this to the smallest possible step? And when you think it is like the most idiotic smallest possible step, that is where you've hit the best step to take. Right? Because if you start to put those little tiny steps into place, they will build on each other. Right? You will start to kind of get going and you'll feel successful. And once you start feeling successful with dealing with uncertainty, with dealing with change, with making kind of those bold moves, then you're going to feel better about doing more of them. It's when you don't do them ever that they feel really uncomfortable. Right? Doing things that are new is hard for folks. The other piece is to help people see what's not changing. Right? At this moment where it feels like everything is a super big whirlwind, I'm coaching someone right now who is the head of nursing at one of the big Kaiser hospitals out in California. Right? And he's like, literally every time I talk to him, he's like, and the whole world has just changed again. Right? Like every week, it's like, it feels like everything has changed. I'm like, okay, so what's not changing? What can you talk to people about that isn't changing? Can you anchor in on the things that are staying the same so folks can feel like there is something that feels like it's the same for them? And the next is that communicating the why, right? When you go back to that payroll company changing, if you sent an email to the whole company and said, hey, we're changing payroll providers because the last one, they've had some data leaks and we're worried about your bank information getting out on the dark web. Okay, people may not be as excited to put into a new payroll system, but at least they understand why. And so often, the why is only known by the folks at the top, right? The lower you go down on kind of any org chart, the less likely it is that you know the why. So think about what is that why and can you get people to know it? If you don't know the why, you can be honest about it and say you don't know why, or you can just make stuff up that make people feel better sometime. Right, and the changes we're going through now are inevitable. You know, I think of earlier today, somebody was talking about AI in one of the first think it was the first panel, we were talking about AI, right? It's everything from automation. I was at a healthcare conference in Boston recently, and one of the other speakers was talking about using AI. The admin team was using AI and how to make their jobs easier and faster. And how are they figuring out how to do that, to do automation, to increase productivity, and still be conscious of the ethical concerns of it. Right? There was a recent study that said something like every AI search uses like 10 gallons of water. I don't know if that's true or if it was just some random thing that I read, right? But people are talking about every time you're doing an AI search, that amount of computing that takes it to do that stuff so fast can be an ethical concern for folks. One of the colleges I work with now has the rule that you actually have to ask a student, I was working with an advisor team, and they have to ask their students before doing an AI search if they are okay with doing it right then, right? Like, right now, are you okay with us using AI to do something? Because of that ethical concern. Right, the insurance and healthcare changes, the idea of people wanting to be in hybrid or remote roles. There's not a whole hell of a lot of, healthcare is one of those things that most of it is in person still. And it has to be, right? There are many things that cannot be done in a remote way, right? We are not going to be able to do a CAT scan on you from your living room couch yet, right? Maybe in the future, but not right now, right? And so people want these roles. Post a remote role. Has anyone here a hiring manager and ever got to post a job that is fully remote? Did you get like 8 billion resumes for it? Right, no, you had a no back there, wow. I was gonna say, I find that as soon as you put remote next to it, it's like everybody comes out of the woodwork to apply, regardless if they're even qualified or interested, right? People think this idea of working remotely is phenomenal all the time. Fun fact, it also can be lonely, and it is you sitting by yourself on Zoom all day, which is not good for anybody. Right, the employee well-being, how important that's coming up these days, the amount of burnout that's happening in the workplace, the amount of our staff who are so stressed out that attendance has dropped, right? The amount of people calling out sick, and people aren't calling out sick because they have the flu, right? Why are people calling out sick? They need a break, mental health day. It's the first sunny day in 6 weeks and they want to go golfing. Right? But it's not, people aren't calling out sick always because they're sick. They're calling out sick often because they're stressed, right? Which, it's mental health days, but it's not because they have the flu, right? And so as we're thinking about how are we able to support people through change, we have to think about that well-being of our staff. Some staff are going to be super excited, whatever you drop, right? I could come into some people on my team in the past and be like, hey, I'm changing this. And they're like, great, can't wait. And you have the people who are going to be in the pit of despair. Right, so now we want to get to the let's go phase, right? This is where everyone wants to be. How do we get going? And I always come back to who can you get people to collaborate with? Can you team people together? Can you team your negative Nellies, your pit of despair people, right? Can you attach them to someone who's excited about the change, right? Those evangelists out there. Can you be innovative? Can you use some design thinking? We'll look at that in a second too. And make sure you're sharing your process about what's happening. It's going to be easier for folks. So if you look at that design thinking approach, this is a way so many places have been able to make those kind of bold, courageous changes, right? Those changes that are different. And the step one of design thinking is this idea of empathizing with the customer. One of my favorite design thinking case studies out of IDEO, which is out in San Francisco, West Coast. But I had a friend who worked there. And one of the projects she worked on was redesigning an emergency room. And so in order to empathize with the customers, right? Who are your customers in the emergency room? Your patients. She and 3 of her staff all went and sat in beds and waiting rooms in the emergency room for 24 hours because it is not uncommon at the emergency room they were working at for people to be there for 24 hours. That was, right, it's not uncommon in many emergency rooms, right? So they all kind of went through the different processes and came back. And they came up with a few things that have now become national models. One was doctors, nurses, techs wearing different colored scrubs. Right? Because they said when they were in there, the confusing thing was whoever came up to your bed, they often were saying things like, you know, hi, Steve, like, can you help me with this? And they're like, no, I'm the doctor, I'm the nurse, I'm the tech, like, I can't do that. So they came up with something as simple as if we had people with different color scrubs and on their name badges were big letters what their job was, right? That made a big difference. It helped people a lot more. But the one that I thought, which is brilliant and really smart, and like I said, used throughout the country these days, but the other one that I thought was really, really interesting was they painted the ceilings of this hospital. Because if you were lying in a bed, what are you staring at most of the time? You're staring up. And so they painted the ceilings in a few ways. In each room, they had murals painted. So there was something interesting, but all of the murals were like a Where's Waldo kind of mural. So when you were looking at it, you could find certain things. They were like hidden picture murals. So at least it was something interesting to look at. The other one that they did is they painted lines to go to different places in the hospital. So the other place that I know that has this, but it's on the floor, is Boston Children's Hospital. Having spent many hours there and having worked there back in the day, but having spent way too many hours there as a parent, one of those nice things was to be able to follow the color lines on the wall or the floor to get me where I needed to go. You need to go to cardio, you follow cardiac, you go follow that. And you need to go for an x-ray, you follow the blue. This hospital did it on the ceiling. So when you're laying on the bed and they're saying, we're taking you to x-ray, it actually had where you were making turns because they said that was stressful to patients, right? Because when you're laying in a bed and they take a sharp left, it doesn't feel really comfortable, right? So they've emphasized with the customer. They start to look at what does the customer need. And sometimes your customer is going to be your staff. Sometimes it might be the other staff in the group. It might be, you know, outside patients. It could be students, right? Thinking about who's your customer and what's important to them right now. And if you're not sure, there's a great tool. It's called an empathy map. If you look it up, there's a lot of free ones out there. I can gladly share one with you if you can't find one. But it's a kind of a whole mapping system of thinking about how do we look at what's important to the people who are the end customer for this. Right. Then you define the problem. What is the actual problem we're looking to solve here? Because often what we think is the problem is not the actual problem. Right? What we think is the problem might be what we've heard people say, but there might be something else. And then we start to trial and test and kind of try things, fix them, try things, fix them, right? Keep going around and around. And this is where change feels really tough because you're going to be piloting things that don't work. And at this point where you're dealing with like budgets getting cut left and right and programs changing and how do we approach this, or you're gonna have to be changing things quickly and they may not work. And so to be able to get in that mindset of I trial, I test it, then we go back and come up with some more ideas and we try it again, right? Getting people in that mindset can kind of help move them. So the question I get asked everywhere I go is how do we go from seriously to the let's go phase of change and totally ignore the pit of despair, right? How do we avoid the pit of despair? Right? How do we build that bridge across from one to the other? So a couple of things. The first is to find your evangelists. Find the people who are excited about this idea. Find the people who come to you when you announce it and they go, yes, right? Like this is exactly what we need. Find the people who come up with 7 ideas about it when they start talking about this is what we need. When you have your people who are super comfy on the floor in the pit of despair, right? Like if you know who they are, because some of you could probably say exactly who those are going to be before you even announce the thing, right? You know who's not going to be excited about this. Can you give them a role? Can they have a piece that they are in charge of? Because if you give them a role of something they're in charge of, well, now they have something to do, right? Now they're also in charge of making it successful. The next one is that whole ideate, test, and ideate again, right? Know that whatever you're putting out there to say to folks, we're trying this and we're gonna be fixing it and moving forward because we don't know what the rules are gonna be next month. Because we don't, right? It's like, we don't know what the rules are gonna be in 6 weeks. We don't know, when the government is coming back. The conference I was at this past week, Charlie Baker, who used to be the governor of Massachusetts, but who's now in charge of the NCAA, was one of the keynotes. And he kept saying over and over again, when and if the government comes back. And every time he said if, the whole room made these collective moments. We're like, Charlie, what do you know that you're not telling us, right? Right, and create those atomic habits. Create those little habits. If you haven't read the book Atomic Habits, I feel like James Clear should be paying me because I think I talk about it in every event I ever go to. Definitely one of my favorite books. But one of the pieces of Atomic Habits that I loved was the idea of getting in your head of who is the person you want to be. And so he talks about if you're someone who wants to go run marathons, then every time you're making a decision, thinking to yourself, I am a runner, what would I do? I'm a marathoner, what would I do? What does a marathoner do? What does a runner do, right? If you're trying to be healthier, what does a healthy person do? If you're trying to lead a team differently, right, what would a leader do in this situation? What would the best leader do in this situation? I'm that leader, what am I going to do? Right, to adapt that mentality, it's one of my favorite parts of Atomic Habits, is that identity piece. But really, truly, that is your best way to get people over this hump, to get people to get on board with change, is that whole give them a role, find the people who are excited, and bring them on board. So we started with your little wiki sticks, and some of you have made some kind of fun little creations. I want you to sort of just attach them to the other people at the table. How can you attach them together and make a shared structure? And for some of you, when I say this, I get the looks. Often I do this with Legos, and people have to take their Lego creation apart to do this. And I get people who love their Lego creation or they love their wiki stick creation, and they're pretty sad about bringing others into it, right? They don't want to bring somebody else into their thing, right? They have a beautiful braid, and now they have to attach it to somebody's stupid circle, right? Or they made a gorgeous robot, and now they have to attach their robot to a tree that somebody made. Sometimes people don't love this, right? On the other hand, the person who is like, I didn't build anything and I just have a plain stick in front of me, they're like, great, I can attach to you, and now I'm gonna have the best wiki stick thing here, right? So it's the same thing with change, right? You're gonna have the people who are gonna be super excited about this. People are gonna love collaborating, and some people are gonna hate it, right? There are gonna be the people in the world who are like, you know what? I'm so glad I'm not in college anymore and don't have to do group projects, right? Getting assigned a group project was the worst moment of your college, which then you realize as an adult, it's all group projects, right? All right, so here's the thing, right? And you've all probably heard this a million times, right? If you want to go fast, you go alone. It's much easier to build things by yourself. It is, right? When you're the one making all the decisions. And now when you have to get out there and collaborate, you have to get innovative, you have to change, you have to move forward. And if you want to go far, right, go together. You have to innovate, you have to connect with each other. You have to make really good wiki stick glasses over here. I can't see your name from here, but Jonathan wins the prize for the wiki stick glasses. Gold star, Jonathan. Right? But I want you to think about, what are the things that you can change? What are the pieces that you can get on top of? What can you do to help others go farther together? What are things that you can do to bring others along on that pit of despair? It's me, that's my lovely dog, Jack, who is a very antisocial dog, but now he is in my slide deck all the time because it's the cutest picture of him. So I'm gonna demand he becomes social as part of me. But this is me. Feel free to connect with me on LinkedIn. I talk about this stuff a lot. I talk about burnout a lot. I have a table over there where you can make your Lego minifigure if you need to make a mini version of yourself, because I love building with things. And I have my favorite sticker with me today, which is great leaders eat lunch. Because if you are not stopping and pausing, right, you are just not, you're not going to be a great leader. You're not going to be great at anything if you are not taking some breaks and fueling yourself. All right, I think we have like 2 minutes for questions. I think I left 2 minutes left, Joy. If anybody has any questions or thoughts? Thank you. You'd all like to tell my husband no. Yes.
Hi there.
Hello.
Great talk, by the way. This is
Thank you.
awesome. What do you think the relationship is between effort and motivation?
It's tough. The conference I was just at earlier this week was Women Leaders in Sports. And so there was a lot of talk around effort and motivation, right? And the people who put the, is it that if you put the effort in, you get motivated because you get better? Or do you have the motivation so you put the effort in? And, we were talking about it from leadership in general and then athletes as well. So I'm a big believer in Gallup-Clifton strengths. I know I've talked to a few people today about it. I think it's your perspective on how you do things. And so what motivates everyone in this room is different. I think my top strength is one called Maximizer, and it is the strength of I like to take things that are good and make them better. So that's what motivates me. But if your top strength is discipline, and what motivates you are all the ducks in a row, and that things are the same, right? We're getting motivated by really different things. So you have to know what motivates you. And once you know what motivates you, it's a lot easier to put the effort in. When I think of those strengths, discipline and consistency are my last 2 out of the 34. So I struggle with that a lot. Like I struggle with things being disciplined or consistent. So I've learned I have to pay for it, right? I have to pay a trainer at the gym for me to show up at the gym. It's just not something I'm motivated to do. Like, would I love to be in better shape? I would love to be in better shape. Just that, the idea of that doesn't motivate me enough. Paying Nikki and not showing up or getting a text from Nikki 15 minutes before that says, drop what you're doing and get in your car. It's a lot more motivating to me because I've already paid her, whether or not I show up, right?
Questions, comments? I just want to say thank you so much for calling, and fun story. We started our careers together as job developers way back in the day.
A million years ago,
back when we were doing things with manual paper resumes and fax machines. And so I love the idea of career pathways and embracing the squiggle. And I love that you all connected together because we are all in this together. So thank you for helping us think differently.
Yes, thank you. Bring your wiki sticks home, or if you need more, there's a box of them with Dave.